Hi, everybody. This is Gigi from Wellness on Wheels. Thank you for joining me again for another episode of Care at Home during COVID-19. As you know, the last couple of months have been rather crazy for us here in Los Angeles County. Our numbers have been increasing dramatically. There have been riots, there have been protests in the streets. Our stress levels have gone sky high. Personally, I've been dealing with a lot of people who have been asking for my assistance, and in those days that we're facing right now, it's been very difficult in the healthcare community to assist people the way we used to. Whether you're young or old, if you're in a hospital situation, a skilled nursing facility, an assisted living facility, there are no visitors anymore. If you happen to get sick, your family advocate, your professional advocate is working with you sight unseen. Most people are now facing crisis management situations. And what I've been dealing with in the last couple of months is just that. Their families who are facing real crises. I mean, people who are in the hospital with no real support, are confused, they're coming out of a hospital situation, don't have the proper care. So I've really had to delve in, roll up my sleeves, and practice a whole new way of advocating for people. It has been very trying. Every circumstance that I've dealt with has been more difficult than the other. Uh, and specifically, when we are dealing with people who are very compromised mentally and physically. So it's not just seniors, but I've also dealt with someone who was my age, and it was a friend's daughter who had not been seen by her family in many months because, as you know, all these facilities have been on lockdown. So families don't really know what has happened to their loved ones during that particular time. They can't visit, so they don't really understand the sense of decline that's taken place. So in this particular situation, we were facing a someone's care who had not been attended to very well. She had declined tremendously to the point where she had to be rushed to the emergency room. Luckily, at that time, I knew a physician who was able to take on the case and follow her and give us his perspective of what was going on. We really had no idea how much of a decline had happened to my friend's daughter, and it was very traumatic to everybody. And not being able to actually physically see her, visit her, reassure her, make sure that she is going to be okay. It was very dramatic in terms of what we could do in a very short period of time. What I've noticed at this particular venue, of our time, is that the healthcare frontline workers, the doctors, the nurses, social workers, discharge planners in hospitals are really very supportive, more than they ever have been, because they become our eyes and ears for our families. Um, they connect us to our loved ones. They try to tell us what's really going on. It is really a very difficult scenario. I've never really um, experienced this before. Even when I was working with my own parents, I was there every day, making sure I was hyper vigilant about their care and the amount of, services they were getting. But when you can't be there to advocate on behalf of your loved one, it becomes very difficult. Somebody has to take a position of objectivity and really guide you to what needs to be done, how it needs to be done, and how quickly it needs to be done, which is what happened in this case. It took us a couple of weeks to figure out how we can help this beautiful woman to get to a stable place and a safe place. And fortunately, we were allowed to have an opportunity to put her in a skilled nursing facility that had opened and have the same physician follow her. Now, that's an unusual situation because most doctors are unable to follow their patients from one location to another. So we were quite blessed in the sense that we have continuity of care. So that was one particular situation that I had to deal with. The others were basically other kinds of crises of lack of knowledge and planning as to the kind of services you could have or need once you get home from your hospitalization. Most of the time now, families are having to scurry to find solutions at the last minute. It's very hard to plan for these things, and especially when there are emergencies that take place, and we don't really know what to do, how to work with the services that are in the community, how to make proper judgments of the quality of the services in these communities. And often we can make mistakes because there are people out there just waiting and prying on the um, lack of knowledge, if you will, and the crisis sense that people give off. So there are many people who are out there just expressing their ability to do the work, but may not be able to have the skill set to do the work. So, in some of the circumstances I was given an opportunity to consult on, there were many of these situations where families were faced to make decisions based on what they thought was their knowledge in the field of caregiving or palliative care or hospice care, thinking that, well, my family or my friend had these kinds of services, they recommend so and so, without really asking the right questions. So even if you're in crisis, it helps to have an objective person working on your behalf, like myself. I had the honor to do that for my friends and their families, and was really able to guide them through this very complicated time that we're living in. So I urge you to start thinking about a plan, start thinking about what you would do and who you would call, who is able to advocate on your behalf. Anything can happen. We could get sick. You could certainly have an emergency and you have to be rushed to the emergency room. And your loved one may not be able to go with you. And you are now faced with the idea of being alone in a hospital setting or wherever you may end up in the emergency room and having to fend for yourself. Um, it's really, really important that you all think about having an advocate who you trust, who you feel you can call on uh, during, before the things happen, but certainly have somebody already in mind. I'm happy to help you. I've been doing free consults that are half-hour consults telephonically for anyone who's interested. And then after that point, we look at the navigation process and how much time it takes to get you to where you need to be safely. So I wish you well. I wish you health and well-being, and I hope to see you soon. We will have more guests appearing. I will have some really interesting guests coming up. We will have our trust lawyer, who is one of our partners. We will also be inviting our key team members to join us for interviews to tell us about how they're dealing with the COVID crisis with their patients. So I bid you well again, and I hope to see you soon. Thank you.